So the pelvic floor is a group of muscles in the bottom of the pelvis. So I will show you here the bottom of the pelvis. What we're looking at here is your superficial muscle layer. So these muscles are responsible for closing around your 3 openings and relaxing. So closing and opening is important because we have to be able to relax and open when you pee and poop, and then also close whenever you're sneezing and coughing. So both of those actions are really important. The muscles on the inside are responsible for pelvic organ support. So your bladder, your vagina with your uterus on top, and then your rectum all sit in this basket-like hammock in the bottom of your pelvis. It too also has to react to what you're doing. So whether you're getting up from a seated position or lifting your child or going for a run, these muscles have to respond to that change in pressure and movement so that you don't experience any symptoms. Those symptoms would be like urinary leakage, pain, increased pressure, like something's slipping through your vagina. Those types of things are not normal, and typically those indicate a problem with your pelvic floor. It's because if you are getting older, that doesn't mean you have to accept these symptoms. Typically, everything that involves bowel, bladder, sexual function with the pelvic floor can be improved because the pelvic floor is a group of muscles, and muscles are really adaptable. They can change in coordination and strength and flexibility, and so we use that adaptability to our advantage, so that no matter how old you are, you can really succeed with physical therapy because we're honing in on that adaptability. I would say Kegels are a very incomplete picture of what your pelvic floor can do. So it's as if, if you wanted to strengthen your glutes, if someone was like, you should just clench your butt cheeks over and over again. Like, that seems silly, right? So that is pretty much what Kegels are to the pelvic floor. So is it helpful to know how to squeeze those muscles and where those muscles are located and to improve your awareness? Yes, but that is just the start of it. Knowing where those muscles are is just the beginning of being able to utilize that group of muscles to your advantage. We have to do a Kegel while we're sneezing and coughing or while we're lifting our child. And so integrating that into your daily life is where the magic happens and where you actually see improvement. So yes, Kegels are a thing that we use to our advantage, but they are incomplete in their use. And so that's why you want to see a pelvic floor physical therapist. Not everyone benefits from Kegels, just like we were talking about that your muscles have to both squeeze and relax. If someone's muscles are really good at squeezing but not very good at relaxing, then sometimes their issues can be due to these muscles being too tight, and so they would actually get worse with Kegels. So that's why, not only are they ineffective, but sometimes they can be harmful or make a problem worse. And so that's why we don't just blanket statement recommend them to everyone. As far as exercises you should avoid, basically anything that's making your symptoms worse. So if it's causing you more pain, more leakage, then it's best to modify that exercise so that you're not experiencing symptoms, or to just change an exercise. So a physical therapist is the expert in exercise and modification, and so if you are experiencing leakage with running, for instance, then come to see a physical therapist because we'll be able to help your pelvic floor adapt to those changes so that you're able to run without urinary leakage. At first, we start with just how do we engage the pelvic floor, and that's kind of returning to that Kegel, right? Are you able to squeeze that muscle and relax that muscle and move it through its full range of motion while you're laying down? Because that's the easiest, right? Like, we're laying down, we can think clearly, and we're just learning how to engage and coordinate that muscle. Then after we have a good hang of that, we're gonna progress it. So if your problem, for instance, is that you don't have enough strength of your pelvic floor, then we're gonna pair the pelvic floor contraction along with your core and your breath to different exercises to progressively load your pelvic floor so it gets stronger and so it knows when to contract. So your pelvic floor is supposed to contract on the most difficult part of the movement, or the movement that's going to create the most pressure downwards on your pelvic floor. And so we want to contract and lift those muscles during that increase in pressure so that you don't experience increased pressure downwards or leakage, because it typically occurs when you're sneezing or when you're doing that jump, right, on the most difficult part of that activity. And so then we start to pair those different exercises with a pelvic floor contraction so that your body relearns how to squeeze those muscles when it needs to so that you're not experiencing symptoms. I would say in general with pelvic floor physical therapy, it seems to be that people are really surprised how active it is. So I think people usually envision like laying down and doing Kegels the whole time for 45 minutes, and that's just usually not what happens. So it can be a lot of different things depending upon what you're experiencing. So if you are experiencing a strength problem, then it'll likely be a lot of strengthening. So doing some mat exercises where you're doing body weight activities, and then improving your flexibility, doing stretches is also important. If you are a person that has, like for instance, pain with sex, then we do something called dilator therapy, and that's something where it helps to train your brain and your muscles to relax in response to stretch. And so that can be really helpful for our oncology population who's undergone radiation therapy, for people who experience pain with sex or after they have a baby or during that perimenopause era. So it looks different depending upon what you're experiencing, but overall, I would say it's usually involves exercise, which can be strength training or flexibility training, kind of depending upon your symptom presentation and your muscle presentation as well. For more pelvic health tips, hit subscribe to our channel.